Well, that's a good start. I have managed to skip my title slide. So I'm talking today about mental health amongst autistic men, women, and non-binary adults. The most recent gender estimates we have for the ratio of autistic people is 3:1 males to females. And we know from a lot of research looking into gender differences that autistic girls have to display much higher symptom levels and particularly far more challenging behaviours to reach a diagnosis, even if their adaptive functioning is at a similar level to their male peers. And that means that late diagnosis is particularly common for autistic women. There are a range of phenotypic and behavioural differences that have been identified in autistic women and girls. Things like much more successful social relationships, depending on how we define success. Differences in their special interests and their restricted behaviours. But we also know that many adult women with autism present with a range of mental health crises prior to getting an autism diagnosis. However, all of that research assumes that there are just two genders. As the conference opened with, the extreme male brain theory, for example, one of the founding theories of what might be behind autism, assumes that you can either be male or female and that is it. However, we've got a lot of evidence in the last few years that autistic people are more likely to be LGBTQ and have non-binary or transgender gender identities. There is, however, to date, no research on the combined impact of being autistic and having a minority gender identity. In the neurotypical population, we know that those who are LGBTQ, trans and non-binary are much more likely to have mental health issues and at much higher risk of attempting or completing suicide, for example. We also know that the same things are true in autism, and it's likely that those interact and perhaps result in even worse outcomes and greater risk factors. Anecdotally, autistic people who are non-binary talk about there being a significant impact of their gender on their ability to seek and access treatment, because things like inpatient wards, particularly in the UK, are normally single sex. So if you don't fit into one of those categories, you may be denied a place in that treatment centre. As I've said, autistic people are much more likely to have mental health issues than neurotypical people, and there was a brilliant set of sessions covering that yesterday. And anxiety and depression are the most common mental health issues for autistic people to have. Potentially, there is a double jeopardy for autistic females, and as yet, we don't know whether that's also true for non-binary people. To quickly run through anxiety, depression, and eating disorders, which are the things that were covered in this talk. Autistic people are found to be more anxious across the lifespan. That set of studies covers autistic people from the age of about 3 through to old age into their 60s, 70s, 80s. And 40% of people have at least one anxiety disorder, and of that 40%, 70% will have 2 or more. Similarly with depression, around 40% of autistic adults meet the clinical criteria for depression, and that increases with age. 50% of autistic people report engaging in non-suicidal self-injury, and autistic people are much more likely to have suicidal ideation, suicide attempts, and sadly, suicide completion compared to the neurotypical population. Particularly importantly, in the context of my work, autistic women are 3 times more likely to complete a suicide attempt, as well as, we heard from Sarah Cassidy yesterday, being up to 13 times more likely to make that attempt in the first place. Eating disorders is another area of mental health where there's theoretical and growing empirical evidence for an overlap with autism. So far, that's particularly been looked at in terms of anorexia, where it's been theorized that things like cognitive inflexibility might contribute to food selectivity, food refusal, and lead to the maintenance of that eating disorder. However, most food research in autism has been done with children and is normally looked at trying to improve or widen the diets of young children rather than working with adults who have an established eating disorder. I'm going to point out that camouflaging is a specific risk factor, particularly for autistic women's mental health issues. Many autistic people camouflage or mask aspects of their autism, and here I am talking about those who are considered cognitively able generally, and this is defined as a mismatch between the external presentation and the internal state. So the behaviours that other people can observe versus how the person feels, thinks, and would act if they were not being observed. The more people do this camouflaging, the greater their chances of having clinically significant anxiety and depression, and it's also been found to be a specific risk factor for suicide attempts. And the evidence to date shows that autistic women and girls do this more, which adds to that double jeopardy effect that I was talking about. So the study I'm presenting here was a large online study that was run for about 3 months. It was advertised through Twitter, through social media, through university networks. So the participants are not all from the UK, although about 80% of them were. And we got nearly 1,000 participants between the ages of 18 and 81. That's a lot of statistical information, which basically tells you all those little things that I've just said. Our gender breakdown was quite interesting. So we had similar numbers of autistic and non-autistic men, vaguely similar numbers of autistic and non-autistic women, but we had far more autistic non-binary individuals than non-autistic non-binary. We had over 140, I think, versus just under 20. So from the very off, it was clear that autistic people are much more likely to have a non-binary identity than non-autistic people are. So looking at how people reported, they completed the Hospital Anxiety and Depression Scale, which has been validated with autistic people, and also the EDEQ, which is an eating disorder questionnaire that has not yet been validated, but we're using this data set to try and publish a validation. We found that autistic people, unsurprisingly, are more anxious than their non-autistic counterparts, with about 38% versus 40% reaching clinical cutoff. That doesn't look like a big number, but a big difference, but because of the number of participants, it was statistically significant. We also found that autistic people were more depressed than their non-autistic counterparts. Again, not a surprise in the context of what we've heard in this conference. There, the difference was much bigger. So about 13% of non-autistic people met the clinical cutoff versus nearly 22%. So that was a much bigger difference and came out again as highly significant. When we were running some models with it, we found that for anxiety, both gender and autism status had a significant impact on anxiety, and that there was a significant interaction. So men, both autistic and non-autistic, were the least anxious. Then women and non-binary people were quite similar and were much more anxious than both autistic and non-autistic men. For depression, interestingly, there was no effect of gender alone. So men, women, and non-binary people, autistic and non-autistic, scored relatively similarly. But autism did have a significant effect. So regardless of gender, autistic people were more likely to be depressed. Interestingly, there was then a significant interaction. So we found that autistic women and autistic non-binary people were much more likely to be depressed compared to autistic men or to non-autistic everyone. On disordered eating, it's important to say that the EDEQ, although it's used in a clinical setting, does not give an absolute diagnosis of a specific eating disorder. It covers a range of disordered eating practices, which is why I'm reporting on disordered eating, not eating disorders. Autistic people were much more likely to endorse disordered eating in a range of ways, so either restriction, avoiding certain foods, or things like binging and purging. And again, the difference in the numbers who endorsed that behaviour was significant. And we found that both gender and autism had a significant effect. So women and non-binary people were more likely to endorse disordered eating, and autistic people in general were more likely to endorse disordered eating. But we didn't find that interaction that said that autistic women and non-binary people were more likely, as we did with anxiety and depression. Sorry, I keep doing that. We also ran some correlations within the whole sample. These are all corrected for multiple comparisons and things. So AQ score was positively correlated with anxiety, with depression, but interestingly not with EDEQ score. So although we found that autistic people generally are more likely to endorse disordered eating, it was not that as you scored higher and higher on the AQ, you became more likely to endorse disordered eating. It was categorical rather than on a scale. And unsurprisingly, considering work from neurotypical populations, we found that those who scored higher for anxiety and depression were also more likely to have disordered eating. There's a lot of work that endorses that relationship in neurotypicals, so we would expect it to see it here as well. So, as I say, in line with previous research, we found that autistic people were more anxious, more depressed, and more likely to report disordered eating in all genders, and that more autistic symptomatology was associated with increases in anxiety and depression, but not disordered eating. Interestingly, the effect of gender was consistent regardless of autism status. So the patterns we saw in the non-autistic population were replicated in the autistic population in general, in that women and non-binary people were more anxious, more depressed, more likely to have disordered eating than the men, and that women and non-binary people had similar levels of anxiety and depression. Autistic women and non-binary people scored the worst on all of these measures, and that's in line with multiple minority theory, that double jeopardy that I was talking about. If you are both autistic and have what is considered to be a minority gender identity, despite the fact that women make just about half of the population, the world is more difficult for you. You experience more discrimination, you experience more isolation, and so it makes sense that you might have more anxiety, more depression, and those things can lead to or can be contributed to by eating disorders as well. So, in conclusion, autistic people of all genders are more likely to have mental health issues, and we do need to be thinking about all genders, not just men and women or boys and girls. Their cases, when they present to mental health services, are more likely to be categorised as complex needs. They're more likely to present with multiple conditions and multiple needs. And gender has a central influence on experiences of being autistic. We can't say that because you are autistic, there is one way you're going to see the world, and I don't think most people would do that. But we need to recognise that it's not just, for example, IQ level or verbality that changes how you experience the world and your autism, but also your gender, because the world looks at you and sees your gender before it sees your autism, and that shapes how people behave towards you, and therefore massively shapes your experience of the world. I'm just going to quickly say thank you to the University of Bristol, where I currently work, King's College London, where I was based at the time I did this work, and the MRC and the ESRC who funded it. I'd also like to thank all of the, 1,000 people who took part. Most of it was anonymous, so as far as I know, somebody might be in this room. People gave us a lot of information, it took a long time, and it's enabled us to do some really fascinating work. So thank you.
Thanks very much, Felicity. Thank you.